Hi there. My name is Katie Hickman, and I am the Perinatal Parenting Support and Education Programme Development Midwife, it's a mouthful, at UHCW. And basically, it's my job to provide antenatal classes for our pregnant people and their families who are booked at university hospitals, Coventry and Warwickshire. So those families living within Coventry and Rugby. So thank you for joining me today. I'm going to talk to you about early pregnancy. So, congratulations. If I was face to face with you, I'd be asking you, how are you feeling? Obviously, you can't reply to me because this is pre-recorded, but hopefully you're feeling good. We know that you could maybe feeling a whole range of emotions, and it's totally okay to feel how you feel. Pregnancy, birth, a new child, it can be really exciting, but we also know it can be really daunting as well. So we want to talk to you. This is why we want to talk to you and hopefully give you some information and make you feel a bit better. So you may be feeling excited, scared, anxious, nervous, happy, worried. There's a multitude of feelings surrounding a new baby. And like I said, everyone is different. Everyone will have their different feelings, and that's okay. That's okay. How you feel is okay. So, I'm going to talk to you today about common early pregnancy symptoms, keeping active in pregnancy, nutrition, fetal development, community midwife appointments, screening, scans, vaccinations, all the good stuff, mental health, keeping your baby safe, safety information, parenting support, and then some useful contact telephone numbers at the end. But firstly, I want to show you a virtual tour of our unit. Coventry is obviously a huge place, and UHW is big as well. So our maternity unit is one of the biggest within the West Midlands. We hold a level 3 neonatal unit, so we get a lot of the premature babies and trauma and all the complex cases come over to Coventry. We have over 6,000 births a year, and our unit is spread across 2 floors. So it can be quite daunting, I think, when you come into hospital anyway, especially one of our size. So I like to show our virtual tour of our unit so you can see for yourself sort of what to expect when you come into the unit. And hopefully it's not as scary as what it seems. So here we go. Brilliant. So I like that video. I think it's really important. So, like I said, it just helps to alleviate the anxieties of our women who access our services, but also just good to get a visual so you kind of know where you're going. It's a big hospital, and you don't want to be late for your appointment. Hopefully that was helpful. Brilliant. So early pregnancy then. This session is kind of, it's aimed for our pregnant, our women who are between the first and second trimester, generally around between 12 and 16 weeks of pregnancy. But hopefully you'll have had a scan by now. But if not, don't worry, it's not a problem. So early pregnancy symptoms, as you can see there, so we have missed periods. So you may find missed period or menstrual cycle. That's usually your number one a eureka moment to thinking, oh, could be potentially pregnant, but you will likely be feeling fatigued. You may still have some breast tenderness, nausea or vomiting, increased urination, hormonal changes, so irritability. You might be biting your partner's head off, and that's okay. Headaches are a very common early pregnancy symptom. Food aversions as well, they go hand in hand with that nausea and vomiting, and then a heightened sense of smell. You'll find that all of your senses are heightened, and that's the animalistic side of us, protecting our body, protecting our fetus, and back in the day, in the caveman days, it would be that we would use all of our senses to make sure that we were safe and protect our growing baby, and we haven't lost that. So that's why you have the heightened sense of smell. So your symptoms should hopefully begin to subside or improve as you approach the second trimester, around 14 weeks of pregnancy. This is basically due to your body learning and adjusting to the new pregnancy. It's getting used to you and your hormonal fluctuations. It's getting used to you actually being pregnant and carrying your baby. Many women may experience, and hopefully will experience, relief by the second trimester. Okay, so from 16 weeks of pregnancy onwards. However, we know that it does vary from person to person, and just as your pregnancy, everyone's pregnancy is different, everyone's body's different, it's very individualized. It's exactly the same in terms of your pregnancy symptoms. So something that you may experience yourself, your best friend or your sister may not have experienced, or you may find that your your symptoms start to subside at different times than your next door neighbors did, for example. So don't be disheartened or worried. Everybody's different. Everybody's body is different. Everybody's feelings are different. Everybody's pregnancies are different. It's what makes us. But hopefully you will find that those early symptoms will start to subside as we approach the second trimester. So keeping active in pregnancy, we know that exercise is not only good for your physical health, but it's also really good for your mental health as well. So things that you can do whilst you're pregnant, things that we would recommend, obviously low impact sports, low impact exercise. We don't want anybody kickboxing or doing anything that could potentially harm you. Really listen to your body. It will tell you when enough is enough. It will tell you when it's had enough. It will tell you when you can do some more. Really listen to your body. Now, when you're pregnant, we produced a hormone called relaxin. It's what helps all of our muscle fibers stretch and everything become quite supple in pregnancy, and then helps us to prepare for labour and birth, and obviously the process that we have to go through that as labouring women. So just be mindful that any exercise that you do whilst you're pregnant, you are more prone to diseases. You're not more prone to diseases. You're more prone to injury. And that's because those muscle fibers will be looser. That relaxin is working. So just be really mindful. And as your bump grows, you'll find that your center of gravity also changes. So please just be careful. Make sure that any exercising that you do, you are wearing sensible footwear, and you're just aware of your surroundings and of your growing bump as well. Okay, keep yourself safe. But things that we would recommend in pregnancy that are safe for pregnant women include prenatal yoga. There's loads and loads of really good classes out there. If you just have a bit of a Google or look on social media, you'll find lots of prenatal yoga. Swimming, there's aquanatal, which is really good, really nice. It's really nice for the joints because obviously you're buoyant in water, so you're weightless in water. So it really helps you to be able to move a bit easier. And if you are struggling with something like SPD, so your pelvis is painful, or you're finding that you're just generally quite tired because of the weight of the baby, or you're just quite tired anyway because of your fluctuations with hormones, Aquanator is always a nice one. Being in the water, just swimming is just a nice one because, like I mentioned, you are buoyant, and it can be quite enjoyable. Actually, it's pain relief as well. Walking is always a good one. We do recommend walking in pregnancy. Again, just be mindful of where you're going, wear sensible footwear. Try not to do anything too invigorating. We want your heart rate to be raised, but not to the point that you're feeling dizzy or you're overexerting yourself. Low impact aerobics, there's lots of specialized aerobic classes for pregnant women. It's just about looking and seeing what is available out there for you. And fitness classes designed for pregnancy. And we actually work closely with wellbeing coaches as well within the trust, who do Zoom. I think they're on Zoom classes every week, and also for postnatal women as well. They go out and about with the babies. So if you're interested in that, please do keep a lookout or check out our link tree for the links for that. But always prioritize safety, as I've written there. Listen to your body and avoid activities with a high risk of falling or injury. I've got a little video to show you every movement, every minute counts, and then we'll move on. Brilliant. So as you can see there's lots of ideas, there's lots of information, there's so much out there for you to access um, to support and promote that being active in pregnancy, and the health benefits that come with that as well. Not only whilst you are pregnant, but also in the postnatal period too. Brilliant. Okay, so sort of going in hand with that is nutrition. As we know, with activity comes nutrition, and we want the best for our pregnant people. So during pregnancy, maintaining a balanced and nutritious diet is really crucial for the health of both you and your baby. As you can see there, folate and folic acid. So try to consume foods that are rich in folate or take a prenatal supplement. I can't obviously mention any brands, but whatever you find in the local supermarkets or even like in your Savers or something like that, they all legally have to have the same stuff in there. So don't break the bank when choosing a prenatal supplement, okay? But try to get one with folic acid. And this basically helps to prevent any neural tube defects. So we're talking about spinal bifida, essentially. Calcium, so ensure an adequate intake of calcium for the development of your baby's bones and teeth. Dairy products, leafy greens and fortified foods are good sources. And this is a reason why you get free dental checks whilst you're pregnant. Your baby will actually take everything that they need from you, and you are then left depleted. So if you can please try and build up the calcium in your diet, it's going to benefit you as well as your baby. In terms of iron, pregnant women often need more iron, so try to include some iron-rich foods, okay? So as I've written there, those are the things like lean meats, beans, leafy greens as well. Vitamin C-rich foods can enhance iron absorption. So for example, if you are prescribed iron tablets, we recommend taking those with a glass of like orange juice, for example. It just helps your body to absorb that iron a bit better. Okay. So for hydration, so please do make sure that you are drinking plenty of water. Try to stay as well hydrated as possible. Dehydration can affect amniotic fluid levels and potentially include or induce preterm labour. So yeah, just as we should do anyway, really do keep an eye on your hydration levels. Again, you will be left feeling quite depleted if you don't. So if you can get like a big bottle, those Stanley cups are supposed to be quite good, aren't they? Quite expensive, but just grab a bottle, fill it up, and be mindful to drink plenty of water. Okay, limit caffeine and avoid alcohol. We do advise limiting caffeine intake to like 2 cups a day. Just bear in mind that caffeinated drinks are like your Diet Cokes or your Coke, tea. That's also included. Green tea also has caffeine in it, so just be mindful of how much caffeine you are actually drinking. And obviously, we do advise avoiding all alcohol in pregnancy. There is no safe limit in pregnancy, so please don't drink alcohol if you're able to. I would recommend eating small, frequent meals. Okay, so eating smaller, more frequent meals can help to manage nausea and prevent excessive weight gain. There is a myth about weight gain eating for two. Actually, we know that it's only in the third trimester, and actually, we recommend eating an extra 200 calories a day in the third trimester. So the myth of eating for two really is outdated. And actually you can run into more serious health consequences in the long run if you are overeating, and obviously it's not great for you and your bones and your body. Protein, so adequate protein is essential for the growth of your baby's tissues. It includes sources like lean meats, again, poultry, fish, eggs, dairy, legumes, is that how you say it? Legumes? So beans, pulses, nuts. Okay, those are your protein sources, as well as like cheese in terms of like your dairy. Again, just be mindful of your actual portion sizes of those things. They are quite high in saturated fat as well. But lean proteins like your poultry and stuff, that's great. Omega-3 fatty acids, so these are important for the development of the baby's brain and eye, so really, really important. Include sources like fatty fish, chia seeds and walnuts. You can actually get supplements with added omega-3 into it as well if fish and stuff isn't your thing. There's plenty of people that don't like to eat fish, and chia seeds, I think that they're you have to enjoy the texture. So you can actually get pregnancy supplements with added omega-3 in them as well. So in terms of fetal development, as you can see, we categorize fetal or your pregnancy into 3 different trimesters. So you've got the first, second, and your third trimester. So your first trimester is from when you find out you're pregnant through to 12 weeks. Okay, so as you can see there, with the first 1 to 4 weeks, fertilization occurs, and actually when you fall pregnant, you're already 2 weeks pregnant, because we go by dates. So weeks 1 to 4 is when the fertilization actually occurs. Within weeks 5 to 8, as you can see, the organs and major body systems start to form. The heart begins beating and limb buds develop. So your baby is starting to form and develop those tissues. Within weeks 9 to 12, fingers and toes appear, facial features become more defined, organs continue to develop. So your baby is continued, the major organs have already developed, but they're now beginning to develop further. And this is around the time where you'll have your first scan called your dating scan. Okay. The second trimester then moves, so weeks 13 to weeks 26. It's quite a large gestation there. So weeks 13 to 16, as you can see, muscles and bones continue to develop. The baby's sex can be determined, and then what I mean by that is, if you were to have a scan at that point, more the 16-week mark, the sonographer would likely be able to see whether your baby is a girl or a boy at that point. And then weeks 17 to 20, fetal movements are felt. So mum can now feel baby moving usually. This can happen though, actually at a later stage, especially if this is your first baby. So don't be alarmed if you don't feel baby's movements at this point. Okay, it's nothing to worry about. Vernix, a protective coating, forms on the skin. So you may have seen when babies are born, sometimes they're born with like a white, like creamy substance on their skin. That's Vernix. It's basically like it's like a moisturizer. If we could bottle it up and sell it, we'd be millionaires. So it's your baby's protective barrier on their skin, and it helps them, obviously, whilst they're in utero, they're in amniotic fluid, so they're surrounded by water, and it helps to protect the skin and keep it supple. And then weeks 21 to 26, the eyelids now begin to open and baby responds to sound. How amazing is that? Lung development progresses. So your baby is taking in the amniotic fluid and peeing it out, really. And it's their way of practicing how to breathe, taking the fluid in and peeing it out. So it's amazing, isn't it? And now they can start to hear you. So reading to your baby really helps their brain development, speaking to baby, playing baby music. All those things are going to help your little one and their brain development. The third trimester then is weeks 27 to 40, and as detailed there, as you can see, 27 to 30 weeks of pregnancy, the rapid brain development occurs. The lungs mature and the baby can now open and close its eyes. So those eyelids are now not fused, they're able to open and close their eyelids. Weeks 31 to 34, the bones now begin to harden or oscillate, is what we call it, and the central nervous system continues to develop. So they're starting to sort of feel things and they're moving around well, and everything's developing further. And then between weeks 35 to 40, the baby gains weight and may change position for birth. Organs are fully developed by the end of this period. So from 37 weeks of pregnancy, we class you as term. From 40 weeks of pregnancy, we class you as full term. Okay. But as you can see from there, the baby will continue now to grow weight. So they're laying down what we call brown fat. And that's the fat that they lay down to keep them warm, and they become cuddly and squishy. And that's how your baby develops. It's incredible. The human body is amazing. Women are absolutely, they blow my mind. And how this all works is just incredible, isn't it? Brilliant. So in terms then of community midwifery, so community midwifery involves providing antenatal care to pregnant women within their local communities, offering support and guidance throughout pregnancy. Midwives play a crucial role in monitoring the health of both mother and baby, conducting routine checkups and educating women on childbirth and postpartum care. So hopefully you have been assigned a community midwifery team, okay? So we work under an umbrella of community midwifery teams. So we've got Busy Lizzie, Daffodil, Eye Bumps, Jasmine, Orchid, Poppy, Rose, Sunflower, Snowdrop, Tulip, or Lotus. All the flowers. So within that team, you should then be assigned a named midwife via your GP surgery. So your GP surgery will have an assigned midwife that takes all the pregnant women who are registered within that GP surgery. Okay, and that is your named midwife. That is the midwife who you should see throughout your entire pregnancy if you are low risk. If you are deemed high risk and that risk assessment should have been made at your booking appointment, or if anything else is to arise during your pregnancy, this could potentially change. But if you are deemed to be high risk, you will actually be seen by usually in the antenatal clinic at UHCW rather than in the community. And that's so you have the specialised care of the doctors there, but you will be seeing midwives within the antenatal clinic itself as well. You still will have that named midwife, that assigned midwife, but you will likely be seen in the hospital a little bit more than you would be seen by her, but you'll figure it out between the two of you and you'll see her at some point throughout your pregnancy. Okay, so your routine appointments are, as you can see here. So this is a maternity appointment schedule. This is for a low risk woman. Obviously, and then if you're high risk, you may be seen more frequently, and then obviously by different specialities as well. But for the normal low risk woman, this is what we have. So prima gravida is a woman this is her first pregnancy. So she's a primate, we call her. It's her first pregnancy. A multigravida is somebody who's had previous children. So this isn't her first baby. This isn't her first pregnancy. So as you can see, we start off with a booking appointment. The booking appointment is where your community midwife will invite you in to see her, usually at the GP surgery or somewhere else that's appropriate or is good for both of you. And she'll go through your booking appointment. Basically, what we do there is we take a lot of observations. So she'll check your blood pressure, temperature. She'll ask you about your medical history, your previous obstetric history. So whether you've had any other children before, if so, when, how that pregnancy was, did anything arise during that pregnancy, how many weeks pregnant were you when that baby was born, was that baby born like normally or cesarean section, or all those sorts of things. She'll also take a medical history of your partner, not in as much detail as she will do yourself, but she'll need to know certain things about your partner. She'll also talk to you about social factors, basically get a really good overview of you, your life, and your pregnancy and your history. Okay. She would also give you some forms to go to the hospital to have some bloods taken, and she'll inform you of everything, what those bloods all are. Your next appointment with the midwife will be then at 16 weeks. Now, before that, you'll obviously have your dating scan as well. So you'll go for a dating scan, that's with the sonographer, not with the midwife. The next time you see a midwife will be at 16 weeks. And that's the same whether it's your first baby or your second, third, fourth, fifth, 10th baby. Okay. Again, she'll usually invite you into the GP surgery and you'll have an antenatal appointment. She'll check that everything's okay. She'll check your blood results and make sure that you're happy and to see how you're feeling. The next appointment after that will be your 20-week scan. Again, that's with the sonographer, so not a midwife. But the next time you see a midwife will be 25 weeks if it's your first baby. If it's your second or subsequent baby, we don't see you at the 25-week mark. Okay. At 28 weeks, we'll see you again. Again, you'll have some blood forms given to you. You'll go and see, usually have those done at the hospital. And this is the same whether it's your first baby or your second, third, fourth baby. We'll then see a first-time mum at 31 weeks. We see both first-time mums and subsequent time mums at 34 weeks, 36 weeks, and 38 weeks. We'll then see a first-time mum at 40 weeks, and we'll then see both at 41 weeks. Okay. Now, during those appointments, we'll also potentially measure your tummy to see how baby's growing. And we'll also have a little feel, and we can listen in with a sonic aid, it's called, to listen to your baby's heartbeat. Now, you can bring your partner or your mum, a friend, someone with you to those appointments as well. You don't need to attend those by yourself, and that's the same as if you were in the hospital as well. Okay. Now, this is quite a busy screen. I do apologise, but this basically details screening, scans and vaccinations. So this basically details your scan appointments and when you should be seen. You are welcome to take a screenshot of this one and try and zoom in. It's I can't quite see it myself, but yeah, this information is actually found on the NHS website. It's the optimum times for testing. It's the antenatal and newborn screening timeline. And you can access, like I said, this online on the NHS website. That details what happens when it happens and how it should happen. Okay. Now, in pregnancy, we do recommend whooping cough, the flu vaccination, which is seasonal, so between October and April, and anti-D for our mums who are rhesus negative. You will know after your first appointment, when you come back, you've had those bloods done, you will know whether you are rhesus negative or not. You'll know your blood group, basically. So yeah, we do recommend whooping cough vaccination in pregnancy as well. You've likely have seen that there's lots of adverts on TV at the minute about whooping cough. Right then, perinatal mental health. I just wanted to touch on this. We know that it's like I mentioned at the very beginning, it's a very it can be quite a scary time, and having a baby for anyone at any time is a huge life-changing event, and we don't know how we're all going to feel about that, and that's okay. Like I mentioned at the beginning, it's okay to feel whichever way you do feel. And like I said there, it's natural to experience a range of emotions during pregnancy and then after giving birth, okay? After you have a baby, your hormones are very up and down, and they're very up and down anyway, but after you've had a baby, they plummet, okay? They really do. Most women will experience what we call the baby blues, and I liken it to sort of when you're at school and it's Sunday night and you've got school the next day and you have that like feeling of doom, unless you really love school. Most people don't. You have that feeling of doom and dread. That's kind of how I felt when I experienced the baby blues. And I think when I talk to pregnant people in the postnatal period, or postnatal mums, they kind of agree. This is kind of it's kind of a common theme of this is sort of how we feel in terms of baby blues. But again, everyone's different, and you may experience it in a different way. But basically, these feelings are caused by a mixture of tiredness, recovery. So you may be in a bit of pain, and also those hormones, those pesky hormones, that play such a pivotal part in all parts of pregnancy and the postnatal period. However, that feeling should go away within a few days. If you find that it is not going away, it doesn't subside within a few days, or you find that those feelings are really having a negative effect on your daily life, then you may be suffering from something what we call a perinatal mental health problem. Okay, so a perinatal mental health problem is one that you experience at any time from becoming pregnant all the way through until your baby's actually 1 year old, 1 years of age, 1 year old. Okay, so it's such a vast time, such a big period. And really, a perinatal mental health problem can affect anyone. Well, you don't have to be predisposed to mental health issues to experience a perinatal mental health problem, and usually it's caused by some hormones, and also something's triggered that. So it may be birth trauma, it may be you're feeling really, really anxious about being pregnant, it may be that that your partner is suffering with a perinatal mental health problem because he's experienced something that he wasn't prepared for. There's a multitude of reasons, and we don't know, we can't pinpoint those that are more likely to develop a perinatal mental health problem. What we ask as practitioners is if you feel that you are struggling, or you notice that your partner is struggling, you're just not quite yourself, then please do let your midwife know, so we can support you in getting the help that you need. There is so many services out there that can support you and be there to provide that support, and information and education to help you. It's just about knowing where to go and actually asking the question. Okay, and as I've written there, nobody is here to judge you, we only want to help you. And this is something for both mums and dads. People seem to think that maternity services are women centered. We're actually family centered. It's about everyone in that family, so we can help you, help us to help you. Okay, lovely. Right then, so on to baby's movements. So as I mentioned, you will likely begin to feel your baby move from approximately 17 weeks of pregnancy. However, for some, especially first-time mums, it can be a lot later. Okay, so don't be worried. But if by around 27 weeks of pregnancy, not by around 26 weeks of pregnancy, your baby should be in a pattern though with those movements. So you should be feeling your baby moving inside. It could be that your partner can feel them now on the outside as well because they're that much bigger. But they should now be in a pattern, okay, of movements. It could be that you sit down to have your dinner one night, and you feel your baby moving, and then the next night, baby's then moving lots, or you sit down the next night and your baby's moving lots. That's a pattern of movement. If you wake up in the morning and you're being booted in the bladder, that's likely. And then the next day and the next day, and it's a rhythm, it's a pattern, it's a continual thing, then that is likely your baby's movements, okay? So it's really, really important that you pay close attention, okay, to your baby's movements. And if they then change, so that could be a reduction in movement, so your baby isn't moving as much, but also an increase in movement. So if your baby is moving much more than they usually would, then that's also a change of movements. Okay, then you really need to seek help from the local maternity unit. So you need to give us a call on to triage and come on in. I'm going to show you this video and it just sort of reiterates that. You. So like I said, if you find that your baby's movements have changed, please do give us a call to triage. And actually, if you can't get through on the phone because we might be busy, usually it's quite busy, and please just make your way in to triage. It's nice to have a phone call so we can expect you, but really we want to be seeing you, so please just make your way in. Okay, one of the questions we get asked quite a lot is how should I sleep when I'm pregnant? I heard that I should be sleeping on my left side, or I keep waking up and I'm on my back, or is it okay to sleep on my front? Please watch this video. It will detail how to sleep safe during pregnancy and hopefully help to clear up any of those questions. Perfect. Okay then. So things that you should be aware of then during your pregnancy, things that are sort of red flags, as I've listed here. So vaginal bleeding, already any amount really of bleeding is not normal in pregnancy. It's always something that we need to explore and address. So if in doubt, call us on triage, but vaginal bleeding is a big one. Severe abdominal pain or cramping, so especially if it's persistent and not relieved by rest or changes in position. If you're finding that you're having abdominal pain or cramping, again, that's not normal in pregnancy, so please let us know. If you experience any severe headaches or visual disturbances, so these can be signs of conditions such as preeclampsia. Visual disturbances could be, like flashing lights, just dizziness in general, when you might get up and you feel a bit woozy. Those are the kind of things that we're thinking of. And in terms of severe headaches, those are the ones that they're not going away. You've taken paracetamol, it's really affecting you. Severe headaches are something that we need to look into. If you experience any sudden swelling of the face, hands or feet, so this can be indicative of preeclampsia or other conditions. Pregnancy itself can cause you to swell anyway in your hands and your feet, but you'll know the difference if you're finding that your rings are stuck, or you're just puffy and your face is puffy. These are things and other things that we need to be checking out. Any significant changes, as I mentioned, in fetal movement, always contact your local maternity unit. If you experience any persistent vomiting or diarrhea, this can lead to dehydration. And as we spoke about that at the beginning of the session, that can be detrimental to the pregnancy as well. We want to make sure that we're keeping you nice and hydrated. Okay, so please let us know. And if you experience a fever, okay, so a high fever could be a sign of infection, okay, which can be harmful during pregnancy. Always get that checked out. Always get that checked out. So those are my details there. My name, as I mentioned, is Katie. That is my email address. I have got a link tree which has loads of information on there with regards to pregnancy and postnatal period and things that are going on in the local area. Please do check them out. We do hold currently face-to-face classes. We have virtual classes, weekend classes. We have got younger mum class that's launching soon. And we have this early pregnancy class that we hold online, and we also hold it face-to-face as well at the hospital. And we're actually doing some parent craft as well on the actual postnatal ward. We've got our lovely support workers who have started parent craft. So basically looking at how we change baby's nappies, how to make up a feed, how to sterilize things, how to bath your baby, and cord care. Those things we're covering, so you're not left to go home on your own without any idea of how to take care of your baby. So don't be alarmed. But as your pregnancy does progress, you are welcome to join us on any of the classes, any of the things that we're currently doing. And I do update the link tree regularly. We also have this YouTube page that I will be uploading videos onto as well, hopefully to help to reach more people. And also do speak to us about the Real Birth Companies. The Real Birth Company are basically provide us with a digital package, a digital program that you can access free of charge on any smart device. And it's basically a birth preparation class. It goes through a lot about the anatomy and physiology of labour and birth and provides just loads of information. And knowledge is power. It's key. If we can empower you, our lovely pregnant families, then that's half the job done, really, isn't it? So if you go onto my link tree, we do have the details about the Real Birth Company on there. You're able to access that directly. All you have to do is register, and you're able to access that free of charge. And just some useful telephone numbers here. We've got the labour ward triage. Basically, triage is like our maternity unit. It's our A&E for maternity unit. So there's always somebody at the end of the phone, 24 hours a day, 7 days a week, including holidays, Christmas, Easter. We're always there. Midwives never go home. So you can contact us directly via those phone numbers there. We've got the Coventry Community Office, Rugby, the Coventry Infant Feeding Team, the Nuneaton Community Office, Leicester, and Warwick, because obviously we work closely with the local area, and those are those phone numbers that you may need. Thank you for joining me today. I really appreciate you coming on and having a look and seeing what we're doing. Like I said, do keep an eye out for all of the local classes that we have available and the other videos that we have coming up soon. And if you have any suggestions, do feel free to send me an email. It's been great. Take care. Enjoy the rest of your pregnancy, and we'll see you soon. Bye.